I am Dr. Anurag Yadav, Junior Resident Second Year in Srinivas Institute of Medical Science and Research Center, Bangalore. My topic is Contrast Enhanced CT Evaluation of Oral Cavity Carcinoma. Introduction. Squamous cell carcinoma is commonest malignancy in oral cavity. Imaging plays an important role by providing accurate staging and thus planning for appropriate treatment. Aims and objective to evaluate the role of CCT in staging of oral cavity tumors, to compare CCT staging with MRI staging. Materials and methods. Study design, a prospective and cross-sectional study. Location, Srinivas Institute of Medical Science and Research Center. Study period is from September 2024 to March 2025. Age group is adults. Sample size obtained is 18. Inclusion criteria is clinically strong suspicious of oral carcinoma and adults. Exclusion criteria is pregnant patients, medical renal disease patients, known contrast allergies, and patients less than 20 years of age. Methodology and research design. 18 clinically strong suspected patients of oral cavity carcinoma referred for CECT of oral cavity are sample population. CT protocol. Plain CT axial sections of cheek. Start and end location skull base to sternal notch. Average KV 120. Average MAS 180. 60 to 70 ml of iohexol IV contrast agent was given. Recon slice thickness is 1.25 and 3 mm axial and 3 mm cornal. MRI sequence T2 weighted DWI and STAR axial sequence. TNM staging of oral cavity malignancy was performed. Patients were followed up to obtain histopathological staging after inclusion and exclusion biopsy of oral cavity lesions. TNM staging results obtained by CECT and MRI were compared with histopathological staging. These are few of the images in which CECT was done. The results validity of CECT for each of the staging criteria used in TNM classification is described in the next slides. If we compare CECT, MRI and histopathological report, MRI is better modality. Observation and discussion. In study, out of 18 patients, adjacent cortical bone erosion was seen in 4 patients among the study population, of which CECT showed the involvement of all the 4 patients with sensitivity and specificity of 100%. Deep muscle of tongue involvement was seen in 3 patients in MRI, of which CECT showed involvement of 2 patients with sensitivity of 74.7% and specificity of 68.4%. Maxillary sinus involvement was detected in CECT with sensitivity and specificity of 100%. Skin of face involvement was seen in 3 patients in MRI, of which CECT showed the involvement of 2 patients with sensitivity of 81.8% and specificity of 79.9%. Masticator space involvement was detected in CECT with a sensitivity of 72.5% and specificity of 70%. Lymph nodes were detected by MRI in 4 patients, of which CECT detected all the patients showing similar in size criteria with sensitivity and specificity of 100%. The evaluation of CECT with histopathological staging were in concordance, and in rural areas, CECT is the first choice of investigation. It provides reliable information of bone, maxillary sinus, skin, and the lymph node involvement. Conclusion. Oral cavity malignancy is a common cancer in India. Management is entirely dependent on stage of the disease. CECT is a reliable and accurate method for staging. CECT is preferred because of its wider availability, higher compliance, and cheaper cost. The analysis of our study showed good levels of sensitivity and specificity of CECT in assessment of staging criteria used for staging oral cavity malignancy. MRI better modalities for evaluation. References are given below. Thank you.